Okay, hello everybody. Can you hear me right now?
Yes, we hear you loud and clear.
Okay.
Thank you.
Okay, thank you. Okay, I'm speaking from Italy. I am senior researcher at the National Council of Research in Bologna, and I am co-founder and scientific director of Lipidome, which is the company that is proposing the membrane lipidome analysis in the healthcare market. The presentation is shared with Maria Teresa Francavilla. She is a medical doctor, general practitioner, nutritionist, and expert in integrative medicine, which is in Bologna and which is sharing with me the case that we are presenting today. Okay, the genetic disease CHAMP1 is very well known by this audience. And we can summarize the fact that the CHAMP1 protein defect is affecting the chromosome organization and the cell division success rate. But what I like to say today is to bring to this audience is a contribution from the holistic vision for health. That can assist the genetic diseased subject with a powerful assistance from epigenetic. And here you see the title of an opinion paper on New England Journal of Medicine in 2017. The title is Putting Back the Patient Back Together. It's very, very interesting title. It was affirming that in the 21st century, the approach for health it must have a complete vision of the patient. What means that if it is clear that there is a genetic heritage that cannot be missed and cannot be disregarded, the environment and nutrition interact with the fate written in DNA. And our idea started from watching the cell cycle. And when you have a defect in a gene and you have the division, of course, in the daughter cells, you find the same defect. But there is another moment of this cycle that is very important that can accumulate defects as well. And here is in the phase M. In the phase M, as you can see, there is the formation of two cells from one, which corresponds to the doubling of the membrane content. Without membrane, we cannot have cells. And so at a certain moment of this phase M, we have a very large, very huge recruitment of these elements that you see in this oval, gray oval, which are called the phospholipid. Phospholipid are the constituents of cell membrane, and they are made by these tails that you can see here, and they are made by lipids. Here you see on the left, our body is made by several molecules, but we cannot make all molecules that we need. And in red, you can see several molecules that we need to take from nutrition in order to have it in our cells. And among lipids, we have the three families: saturated, monounsaturated, and polyunsaturated fatty acids. But in red, you can see polyunsaturated fatty acid. We cannot prepare ourselves, and we must get it from nutrition. What happened that the lipid pool made by these three families generates phospholipids, which must be in a balanced quality and quantity in order to form membrane. And the forming membrane is a very magic moment, because this is a spontaneous organization of phospholipid. You can see here that the phospholipids are coming close each other by a biophysical force, not a chemical force, and they are organized in a double layer, which corresponds to the envelope of the cell membrane for each cell. And you can see that depending on the type of phospholipid, for example, the straight one are the saturated fatty acids, and the bent one structures are the unsaturated fatty acid, they have practically different organization if you have more saturated fatty acid or if you have more unsaturated fatty acid. And you can see I put it the dashed red lines to show you that if you have more saturated fats, you reduce the length of these, you reduce the organization of these molecules. So dimensions and morphologies of the cells change according to the type of the fatty acids. But this is very well known because of each tissue. Here you see 4 pies. The 4 pies corresponds to 4 different tissues in our body. So you can see from the colors of the pie that, for example, in brain, you have more monounsaturated fatty acids. In lung, you have more saturated fatty acid. In liver, you have more omega-6 polyunsaturated fatty acid. In heart, you have more polyunsaturated fatty acid, omega-3 DHA. But what happens if we don't have a good lipid balance? So if the pool of our fatty acid is not balanced, this is a very important question that actually is, they are 20 years that we are studying this, because it is a sort of defense, auto-defense, self-defense of our cells. Because since there is a spontaneous organization of the membrane, if the lipid pool is able to recruit fatty acids from our nutrition, so if we can put some repair in our lipid pool, also the membrane is repaired as well. So there is the phenomenon called membrane remodeling, that from the lipid pool is able to repair the damages or the errors of the membrane. This is very important phenomenon that motivated the birth of membrane lipid therapy. And here you can see in the 2021, there is a review written on the large applications of this membrane lipid therapy. So we were very much involved in this research. We have the only accredited protocol and the only robotics that is able to analyze the lipidome of the membrane of mature red blood cell and to give an analysis in order to know if the content of the fatty acid is balanced or if it contains defects. We examined several kinds of diseases. I show you, for example, an observational study. We did it in non-cystic children, where we found that in the membrane of these children, there was an increase of monounsaturated fatty acid and a decrease of polyunsaturated fatty acid, particularly 14% less of DHA. And this lipidome was also clinically correlated with features of the autistic children, clinical features. Palmitic acid was correlated with CARS activity and cognitive and development impairment. And also arachidonic acid was correlated with negatively with CARS global score, CARS activity, and cognitive development. So what about CHAMP? I like to conclude my intervention because, of course, research is needed and you are there just discussing this research. By the way, we believe that if you create fragile cells with this genetic defect, it is important that in the mitotic phase, in the phase M, you do not add also the failure of membrane lipidome. This is very important because then you will affect twice the cells, the fragile cells with defects. And here we propose to couple the membrane lipidomic analysis with all the cells that you are researching, also the stem cells, and we can help to classify the membrane lipidome in all these cellular research, and also to evaluate the lipid environment where we grow cells and we examine the fate of these cells. And regarding people, of course, we can say that we can evaluate patients. We know already that the genetic diagnosis is very important to do it as early as possible, but I can tell you that also membrane diagnosis must be done as early as possible. Why? Because we have to sustain cell growth and keep membrane balance despite impaired condition of cells. Because when we do not help membrane, we have a wrong lipogenesis and we favor inflammation and immunity signaling, which is wrong for the growth of cells. And instead, if we help membrane lipidome, we sustain regeneration processes. And just to mention, one case study that we had with Maria Teresa was a baby just diagnosed with CHAMP at 3 months and a half. And he came to us and we examined the membrane lipidome, and we found out an excess of lipogenesis with oleic acid in excess, but also an excess of polyunsaturated fatty acid of immunity, and also a very important element, DHA, for the growth of the tissue. And these polyunsaturated fatty acid were increasing the peroxidation index and the oxidative status. So we treated with membrane lipid therapy in order to control immunity, ameliorate lipid uptakes, protect the oxidative status. And Maria Teresa was watching this baby, and after 8 months, she was seeing a child with a good mobility, attention, and behavior. Of course, the diagnosis at 2 years of this baby tells that there are impairment, retardation, but not terrible impairment. This is very important for to keep this child. But what we showed after 1 year, after 8 months from the lipid therapy, that we had exactly the same lipidome of the first analysis, and we found out only one element that was changed, that it was palmitoleic acid that was increased. And we believe that this is a sign, very important sign, because palmitoleic acid is a lipokine, so it is able to do 2 things very important for the management of tissue. It's mobilizing the lipid droplets, and it is going to reduce lipogenesis in the liver, but to increase the muscle strength. And also in macrophages, especially for the cognitive development, the lipokine is able to create derivatives, hydroxy derivatives, which have a very important non-calcium dependent, very important role to control the inflammatory responses given by arachidonic acid. So, so acting with a real regenerative and control element in the cognitive development. So I conclude my presentation saying, of course, that more studies are needed in cell, in patients, but I like to say goodbye to you with this phrase: membranes are not spectators. They release epigenetic signals for adaptation and regeneration. We cannot miss this important information when we study a genetic disease. Thank you very much for your attention. Here is my email in case of need of contact. Thank you very much for your attention.
Carla, thank you so much. That was wonderful. I just want to open it up for anyone if anyone has any questions. I'd like to ask you. So I know there was a potential collaboration earlier last year with another doctor. Are you still looking to acquire some type of a cell line in order to extend your research? If you can elaborate on that a little bit.
Yeah, I think that it's very important when you consider to study what is the environment where the cells with the genetic defects are living. You must control also membrane lipidome, because maybe you will discover that the rate of replication and also the resistance of these cells can ameliorate once you control the environment where the cells are growing. And actually we do it in cell culture. We are publishing several papers also in other diseases like cancer, where we get complete control of the growth of the cells and of the signaling of the cells. So I think it's very important because, as I told you, if the membrane lipidome is not controlled, you have two effects important. You alterate lipogenesis and you increase inflammation. And the inflammation is always a degenerative signal for tissue. And we must be very, very aware from the creating a non-inflammatory, not completely anti-inflammatory, but non-inflammatory condition for these children, because we have seen in autism that the increase of arachidonic acid is increasing the phenomenon of the autistic behavior. So it is not good to increase arachidonic acid.
Last thing just to add for the audience, because I'd spoken to you earlier about this. I know that you've worked a lot with kids with muscular dystrophy. Can you just really briefly, because I know we're running right behind, just kind of speak to some of the, maybe the positive changes you've seen in some of the kids that you've worked with in that rare disease?
Well, you mean the signs for the children, you mean?
Yeah, so don't you work with a large group of muscular Duchenne dystrophy children, and you've applied some of the protocols to those kids, and maybe speak to some of the effects?
Well, in autism, we apply this concept in non-genetic autism. We are applying this approach with medical doctor, neuropsychiatrists, and we are really seeing clinical effects of reducing the hyperactivity, of controlling attention, and we always suggest to medical doctors to do this control as early as possible, because you know behavior of the babies starts even in the first month when they watch the eyes of the mother. So it is not a behavior you have to wait 3 years old to understand that something is wrong. And every time you watch that the baby is not behaving normally, watching exactly the eyes of the mom when he's sucking, or have some defects, you must immediately control membrane lipidome, because beside even the genetic diseases, which is of course to be diagnosed properly, but there are many children which have defect because they have nutritional defects, and they cannot have a heavy diagnosis of autism when it is not autism, but it's essential fatty acid deficiency, which has exactly the same symptoms of cognitive defects, of not good attention, and this must be diagnosed properly. So we suggest to do membrane lipidome also in other children that show some defects beside the genetic defects. And actually, we in non-genetic disease, we see a lot of improvement. But also in the baby that that I presented, we saw a very important amelioration. And we believe that continuing to follow him, he will not reach the same level of a baby where the membrane lipidome was not considered.
Thank you, Dr. Carla. I have a question for you too. I have heard from Daniele everything that you are doing with Tommy and that you are trying, but I was wondering, like, for our families, what would be your recommendation? Like, I am from Brazil, most of the families here from US. So which would be, I'm just wondering how I can start this conversation with the team that is currently looking at my son. I tried once, I felt a little bit of resistance. So I would like to know, like, what would be your recommendation of how to start, to share your presentation and open a door for them to talk to you, or
no, practically what I suggest, first of all, the nutrition it depends from the age of the children, because if we start from a newborn baby, is different that, compared to if we start with children of 7, 6, 7 years old. Because, and this is my urgency, is to, since I did not know CHAMP before Tommy was living, my urgency to speak also in this audience is that to evidence that at the first diagnosis, as early as possible, it should be intervened with a lipid therapy. Because of course we cannot change the course of genetic disease unless we don't have a gene therapy, but we can absolutely change the fate of the membrane lipidome. A general suggestion would be to try to get this analysis, and on the basis of this analysis start a nutritional nutritional based intervention. But this nutritional based intervention should be done on the basis of the analysis, because each child has its own balance to see. On the other hand, I would never recommend to take integration of omega-3 or integration, whatever integration, without knowing. Without knowing, and you give lipid therapy without knowing, you have to know that lipids are creating an accumulation in the body. And so if you don't know the type, if you don't know the dosage, it could be even a worst. And you can see in the literature, actually in the autism, that many publications do not recognize that the omega-3 are good for the children. Why? Because they don't examine the lipidome before, they give a dosage similar to all the group, and they want to see the effect. But in pharmacology, everything is done on the basis of the need, dosage, type, evaluating the patient. So I always am very surprised that for lipid therapy, which is, I repeat, a therapy that accumulates in the body because we do not excrete lipids after supplementation, this is not considered, is considered like a nutrition. It's not a nutrition. It's better to do a nutrition. It's better, to, for example, in a general way, to eliminate saturated fatty acids. Saturated fatty acids are not good in the nutrition of children with genetic defects, because saturated fatty acids are slowing down the regeneration. So less saturated fats, more monounsaturated fats, not meat every day, but only twice a week, more fish, because fish, small fish, not large fish, small body fish, in order that they can get phospholipid with omega-3 in a good dosage because it's nutritional. Vegetable, fruit, because they contain antioxidant. This is normal nutrition for children. Not saturated fats, not butter, not potatoes, not rice, white rice, and all things that increase inflammation also. So there is a, maybe we can, I propose, maybe through Daniele, I can give 10 rules to follow in order that families should not be wrong in doing a wrong nutrition. I can help in this way. If you like, I can give you this decalogue of this counseling for your children, if you like.
Thank you so much, Dr. Carla. We appreciate it.